What's up, guys? Today we have two questions that deal with ankylosing spondylitis. Let's get started. 30-year-old man has severe pain in the posterior aspect of the left foot that interferes with walking. For the last several months, he has also been experiencing back pain and morning stiffness that is relieved by ibuprofen. His pain and stiffness get better with activity and worse with rest. Which of the following is the most probable location of the pathologic process responsible for this patient's foot pain? Now, this is a classic presentation for ankylosing spondylitis. The person is under the age of 40 and the person has back pain, and his symptoms get better with activity and worse with rest. These are all common presentations for ankylosing spondylitis. Now, ankylosing spondylitis is a disease that is thought to originate within the gut. So there's inflammation that is going on within the gut, and this inflammation is then going to carry over to the bone and cause bone damage. Now, the inflammatory markers that are important to know for ankylosing spondylitis are going to be IL-17 and TNF alpha. Now, a specific finding in ankylosing spondylitis is going to be something called enthesitis, and enthesitis is going to commonly impact the posterior aspect of the foot. This is Achilles tendinitis. And the sites that are commonly impacted are going to be sites that are already under high mechanical stress. So, sites like tendon insertion sites and ligaments. So, the answer is going to be B, tendon insertion site. Now, it's not going to be due to articular cartilage or synovial membrane. Now, these sites can be impacted with arthritis due to ankylosing spondylitis, but if these sites were impacted, then the pain would be within the ankle. It won't be posterior to the foot. So, as a result, it's not going to be A or C. Now, let's do the second question. 20-year man has had 6-month history of increasing neck and low back pain that is most severe in the morning that improves throughout the day, and with activity he has tenderness over the lumbosacral area and at the insertion site of the Achilles tendon. This patient's symptoms are most likely attributable to upregulation of which of the following cytokines? Now, this person has Achilles tendinitis, which is a finding common in enthesitis, and he is presenting with ankylosing spondylitis. The cytokines that we mentioned earlier that are important to know that are associated with ankylosing spondylitis are going to be IL-17 and TNF alpha, so that is going to be the answer. Now, IL-5 is going to be important in IgA and eosinophil activity. IL-10 is going to be anti-inflammatory, same thing with TGF beta. So the answer is going to be C, IL-17 and TNF alpha. These are going to be the inflammatory markers that are going to be important to know with ankylosing spondylitis.